Time is just gone 10 minutes to 10 a.m. as we head towards closure on this morning's edition of News and Views. And it's time now to take a look at what has happened. The announcement has come through where we have now moved to level one. And we are joined on the line this morning by Dr. Waasila Jassat. Dr. Jassat, Assalamu alaikum wa rahmatullahi wa barakatuh. And as always, welcome. Jummah Mubarak to you. Great having you with us this morning.
Wa alaikum assalam. Thanks for having me back. Jummah Mubarak.
Yes, are you surprised that the announcement has come through, or was it expected?
I think it was expected. I mean, the way I look at it, we have these restrictions and these different levels to help us to cope better at the time of a wave. So when we're having a wave, we have restrictions so that we have a slower transmission of cases and we have a fast, increase in hospital admissions so that we don't overwhelm our hospitals. And so for me, that's maybe the most important, purpose of having restrictions in place. Between waves, we try to open the economy and start to resume normal social lives as much as possible, because that's also important. I think we're really coming to a time where we have to learn to live with COVID-19, find a new normality, and not have this intense sort of, way that the pandemic has been affecting our lives from wave to wave. Totally expected that we should go back down to level one. The wave is over in all provinces. We have low levels of transmission right now. And so for the foreseeable future, it will remain this way.
Well, obviously, that is wonderful. It's encouraging to note because last week we did an update on the numbers, and it appears as if, looking at the stats, that all the numbers are actually moving in the right direction in terms of levels of infection, in terms of deaths, in terms of less people making use of hospital services. So at this point in time, it appears that it is very, very positive, Dr. Waasila.
Yeah, absolutely. So, we know that the numbers of cases are low in all provinces, and we know the percentage testing positive is quite low. And so that's encouraging for us because it shows that we've passed the threshold for what we define as a wave. Now, what that means going forward is that we are always, on alert for any resurgences across the country and looking for any evidence that there could be a new wave starting. This is very difficult to predict, and everyone gets it wrong because we don't know. There are so many factors that, influence whether we will have another wave or not. Will there be another variant that's highly transmissible? Will we have high vaccine coverage? Will people's preventive behavior slip and, have more events where there's, more likelihood of transmission? So these are all the things that we can't really predict. And depending on all of those factors, we could have another wave. But I think the other important factor is how high the seroprevalence is across the country. And it's interesting that, estimates are that possibly almost around 80% of South Africans have already had COVID-19. I think that while that's encouraging to say that, that seroprevalence offers us some protection, we must also remember that studies are showing that if you were infected in the first wave, then you weren't protected by the third wave. So we know that immunity wanes. And so even having natural immunity, knowing that we have high seroprevalence, shouldn't give us complete comfort because we know that that natural immunity does wane. And in the next wave, there are people who would now be susceptible who were infected before.
Yes. Now, just looking at some of the key issues, like with instance, we know with gatherings, with funerals, and also looking at curfews as well. Now, these have been relaxed, and we can't take things for granted. We still need to be vigilant. We still need to be careful, I suppose. But also, these are welcome signs, particularly for us who are social animals and looking at gatherings and the like as well. But again, we are in an election month again, and we're going to see a lot more people gathering, coming together. What do we need to watch out for?
So, I think that my approach is that between waves, when cases are low, we should still take the necessary precautions because there are still some people out there with infection. So wear your masks, social distance, limit gatherings as much as possible. If someone has any symptoms, even though there could be a little bit of flu or other viruses circulating, and it could be something other than COVID, but I think take your precautions to protect others around you. If you have any symptoms, isolate and test. But then what's very important is when cases start to increase. So if the NICD or the Department of Health is starting to report there's a resurgence in some provinces, it's very likely it's going to spread to other provinces. If there's a report that there's a new variant that's highly transmissible that we see that was circulating in other countries, it's highly likely that once it starts to circulate here, it will become predominant. So I think we all should, irrespective of what the government levels of restriction are, we must take our own sensible precautions. And when that resurgence starts, we all should go into precautionary mode. Impose your own levels of restriction in your home, stick to your own home bubbles, avoid gatherings as much as possible. I think that those are things that we've learned from the first three waves. We've learned, how COVID spread in our communities from events, from gatherings. And I think that we just have to learn from those mistakes and make sure that we take precautions when the levels of cases are rising.
Yes, and also with the holiday season coming up, and we're going to find people traveling a lot more within the borders of South Africa and also possibly out of the borders of South Africa. So these are certain considerations that one needs to take into account when we are going out, because at this point in time, it's still very unknown in terms of, we know that right across South Africa, the level of infections are down. But for people traveling in and out of provinces, countries, again, vigilance is required.
Absolutely. And I mean, if there are any predictions, it is that by late November, early December, we could be at risk of another wave just because of the patterns that we had in the first three waves. And that's again, the holiday time. And so the likelihood of people getting together over holidays and Christmas and traveling between provinces means that that's the way that, the disease spreads and increases in our communities and between provinces. So I think that we just need to be careful. We need to learn the mistakes. And I think that the other lesson there is that, the only way to really beat this pandemic is to get high vaccination coverage. Now, we know that the COVID vaccine works and that it's safe. We also know that it doesn't protect completely against infections. So there are some people who may get breakthrough infections. But what we know is that the vaccine is able to protect against severe disease and death. And so, if you do get the vaccine, you are fully vaccinated, and you do get infected, your likelihood of having severe disease, needing to be hospitalized, and getting quite sick are much less. It's in South Africa, I think the coverage at the moment is about 30% of adults have had at least one vaccine dose. Now, for me, the worrying thing is that amongst over 60s, only 50% of people have been vaccinated. And those are the people that are at risk. Those are the people that we need to ensure are protected. It doesn't mean that you're young and healthy also that you won't get very sick, because we know that you can. Some people just do get very sick and end up in hospital and get the cytokine storm and have COVID pneumonia. So I think we just shouldn't take our chances. We have a means that has been developed that can protect people, and so we should make use of that means.
Well, Jazakallah khairan so much for that and the advice and for your time as always with us, Dr. Waasila Jassat. We wish you well. Have yourself a wonderful Jummah, and Allah reward your efforts. Allah keep you safe as well. Assalamu alaikum wa rahmatullahi wa barakatuh.
Ameen wa alaikum assalam wa rahmatullahi wa barakatuh.
Dr. Waasila Jassat joining us this morning, providing us with an update after the announcement that was made by the President Cyril Ramaphosa moving to alert level 1. Now, before we end off, just to remind our viewers and our listeners once again that please note that Salam Media will be temporarily off air today, and this will happen immediately after this. That is on Friday, the 1st of October 2021 from 10 a.m. And this is due to upgrades at our broadcast facilities. Our technical team will be hard at work to have our broadcast transmission back online as soon as possible. So we thank you for your patience and your understanding. If you have any inquiries, please contact us on the mobile, on the WhatsApp number 081-717-2300, or you can email us on info@salammedia.com. The time is just gone 10 a.m. It's time for me to sign off. Once again, it's been wonderful being in your company, in the company of all our listeners and viewers on Salam Media, Al Ansar, Durban, Pietermaritzburg, One Nation, 88.9 FM. Have yourself a great Jummah, a spiritually uplifting Jummah, and a wonderful weekend. So until we meet once again, from myself and the team, Assalamu alaikum wa rahmatullahi wa barakatuh.